Chapter 19, ETI, Respiratory Management and Mechanical Ventilation. Oxygen is a tasteless and colorless gas that accounts for 21% of atmospheric air. Oxygen is used to maintain adequate cellular oxygenation. It is used in the treatment of many acute and chronic respiratory problems. Oxygen is administered in an attempt to maintain an SaO2 of 95% to 100% by using the lowest amount of oxygen without putting the client at risk for complications. Clients who cannot spontaneously breathe on their own require mechanical ventilation. This can include clients who need respiratory assistance due to severe respiratory disease, general anesthesia, trauma, or other illnesses. Oxygen delivery devices. Supplemental oxygen can be delivered by a variety of methods based on the client's particular circumstances. The percentage of oxygen delivered is expressed as the fraction of inspired oxygen, FiO2. While the client is receiving oxygen, the nurse should continue to monitor vital signs, including SaO2 for changes, and intervene as needed. Low-flow oxygen delivery systems. These deliver varying amounts of oxygen based on the method and the client's breathing pattern. Nasal cannula, as pictured here, would be a length of tubing with two small prongs for insertion into the nares. FiO2 would be 24 to 44% at flow rates of 1 to 6 liters per minute max. Advantages is that it's safe, easy to apply, comfortable, and well tolerated. The client is able to eat, talk, and ambulate. Disadvantages is that the FiO2 varies with the flow rate and the client's rate and depth of breathing. Extended use can lead to skin breakdown and drying of the mucous membranes. Tubing is easily dislodged. Nursing actions would be to assess the patency of the nares, ensure that the prongs fit in the nares properly, use a water-soluble gel, not oil, only water-soluble gel to prevent dry nares. Provide humidification for flow rates of 4 liters per minute or greater. Simple face mask, as pictured here. This completes page 115 on Chapter 19, ATI. This simple face mask covers the client's nose and mouth. FiO2 is 40 to 60% at flow rates of 5 to 8 liters per minute. The minimum flow rate is 5 liters per minute, minimum, to ensure flushing of CO2 from the mask, max 8 liters per minute. Advantages is that this face mask is easy to apply and can be more comfortable than a nasal cannula. Disadvantages would be that flow rates of less than 5 liters per minute can result in rebreathing of CO2. Device is poorly tolerated by clients who have anxiety or claustrophobia because of the mask. Eating, drinking, and talking are impaired. Use caution with clients who have a high risk of aspiration or airway obstruction. Moisture and pressure can collect under the mask and cause skin breakdown. Nursing actions would be to assess proper fit to ensure a secure seal over the nose and mouth. Ensure that the client wears a nasal cannula during the meals.